Okay, good day class. So for today, we'll have a discussion of our first topic in the CPH class. This is your introduction to community and public health. So hopefully you're all safe today and despite the inclement weather, sana makinig kayo mabuti. Okay? Now before we start, let us look at the different pictures dito. No? So, meron tayong Yossi Kadiri. This is a health promotion or health education program ng DOH, ng Department of Health, promoting yung pagbabawal sa nicotine or sa cigarette and vaping usage, no? And we have also dito sa second picture yung immunization or yung vaccination programs. Again, to prevent yung mga diseases that are preventable by vaccination, such as yung mga smallpox, yung mga diphtheria, no? Etc. Next, we have a physician speaking with a patient, no, potential patient, and we have the general public using face masks, no? And yung flooding. Tapos meron din tayong mga bata, no? Mga infants. And we have here sa dulo, non-communicable diseases. So, as you can see, medyo malawak, no? Or holistic yung view natin in CPH. Ibig sabihin, madami yung sakop niya. So, to compare it to the usual clinical or a medical health, community and public health, pangkalahatan siya, no? Or the general public or a particular population yung kanyang hawak. Whereas when we talk about the medical or the clinical health, no, kung saan pasok yung mga pinag-aaralan natin as medical technologists, is we are only dealing with specific individual cases. Okay? Ibig sabihin, isang sakit, isang pasyente. Dito sa public health, isang sakit, population or community yung target mo. Okay? So, yun yung pinaka-vague na definition or comparison. Pero, marami pa yan. No? Another definition would be, pag sinabing, for example, meron kang tao na lulundag sa tubig and then nalunod siya. Darating yung ambulansya para sagipin siya. Okay? Or para i-revive siya. Yung pagsagip sa kanyang yun, no, ng ambulansya, that would be the medical or yung clinical health, yung treatment, kumbaga. Whereas kung para pigilan mo siya na lumundag dun sa tubig, no? Or para malunod siya, para hindi siya malunod, yung pag-prevent dun, yun yung public health. So that is also another definition. Okay? So let's proceed. So first and foremost, what is health? So health came from a Old English, no, or Germanic word na hal, which means whole or health or sound. Okay? So, ang health po, according to WHO during the 1946, it is a state of complete physical, mental, and social well-being and not merely the absence of disease and infirmity. Okay? Please mag-focus muna tayo dito, no? Because this particular definition it's very significant, no? Ito yung pinaka-importante dyan. So, say for example, meron tayong patient A at patient B. Si patient A, okay, yan. Si patient A, meron siyang HIV positive siya. However, umiinom siya ng mga antiretroviral drugs, no? antiretroviral drugs. Tapos, hindi na siya nagpa-practice ng multiple sexual partners. Tapos, kumakain siya ng husto and nakakapag-exercise siya araw-araw. Okay? So, that would be your patient A. Si patient B naman, wala siyang underlying disease, no? However, hindi siya nakapasok sa school ng isang araw because nagkaroon siya ng influenza or nagkatrangkaso siya. Okay? Other than that, wala siyang HIV, wala siyang ketong, wala siyang or any other sickness na naisip niya, wala siyang tuberculosis, wala siyang heart disease, wala siyang kidney disease. Meron lang siyang influenza, trangkaso sa isang araw. Okay, now, based on the definition of the WHO, sino sa tingin nyo yung healthy? Is it si patient A or si patient B? So yeah, you can pause the video to think about it. Check nyo yung definition and then isipin nyo sino yung healthy. Is it patient A, which is meron siyang HIV positive, however, umiinom ng antiretroviral drugs, kumakain na maayos, nag-exercise daily, hindi nagpa-practice ng multiple sexual partners, or si letter B, which is meron lang siyang trangkaso sa isang araw, kaya hindi siya nakapasok ng school and bedridden siya nun. Okay? Now, if your answer is letter A, is considered as healthy based on the definition, then you are correct. No? Even though meron siyang currently infected siya with the HIV virus. No? But as you can see, nakakain naman siya ng maayos. No? Nakakapag-exercise siya ng maayos. Okay? Umiinom siya ng kanyang retroviral drugs. Ibig sabihin, normal na pang-araw-araw na pang-araw-araw na paggawa ng buhay niya or pamamalakad ng buhay niya, nagagawa niya. Okay? Unlike itong si letter B, nagkaroon siya ng trangkaso sa isang araw, ibig sabihin, sa isang araw na yon, infirm siya or nasa higaan lang siya. No? So, unhealthy siya dun sa isang araw na yon. Okay? So, basically, that's the definition. Not merely the absence of disease and infirmity. Next, another definition of health is it is a dynamic state. Dynamic meaning there are multiple factors that can influence it and pwede rin na ever-changing, no? Nagbabago. Or condition that is multidimensional in nature and results from a person's adaptations to his or her environment. So, ano ba yung mga adaptations na yun? Pwede physical, emotional, social, intellectual, spiritual, and lastly, occupational. So, these all can contribute to the overall health. Okay? So, meron din tayong tatlong main factors, no, na madaling i-generalize when it comes to the dynamic state of health. Okay? First thing is financial. So, say for example, if a rich person can afford higher quality or mas healthy or mas nutritious na foods, meaning they are more inclined to be healthier than those that are poor, na ang kakainin nila would be less nutritious o kaya yung kakainin nila is non-hygienic, no? So, ganun, mas unhealthy sila. Another thing is spiritual. So, spiritual is subjective, meaning there are other people na medyo mas spiritual sila, no? Mas inclined sila to join a particular religion or a particular spiritual group, no? And if they are really committed, ibig sabihin magsimba lang sila, no? Or mag-join lang sila dun sa community ng spiritual group na yun, mas nagiging mas magaan yung feeling nila and mas nagiging healthy sila. Unlike those that don't join any spiritual group, medyo mas hindi nila na-fulfill yung healthy. Now, again, ulitin ko, this might be controversial. This is just a subjective view, no? Siyempre, iba-iba yung magiging view ng mga tao dito. So, this is not proven yet. And for me din naman, hindi siya scientifically proven. However, since it is written in the book, so might as well include it dito, no? So, financial, spiritual. And lastly, yung social. This is integral welfare. And dito tayo magfo-focus niyan. Ito yung focus ng ating one of the focus ng ating community and public health. Yung pagiging integral welfare ng health towards the population, towards the community, or towards the public. Next, we have the interconnections of the determinants of health. So, on determinants of health, if you read the newspapers or if you watch the news, no, especially if they're talking about diseases, most likely you would hear yung determinants of health. So, pag sinabing determinants of health, these are many different factors that could determine health. Ayun, nasa pangalan niya mismo, determine health. So, ano ba yung mga 5 domains na to? Please take note, mga pala, baka makalimutan ko, please take note na pag sinabing determinants of health, this may differ from references, no, from different references or from different websites or from different journals, no? Bakit kasi siya bago-bago? Kasi nga, from our previous slide, anong sabi niya? Health is dynamic. Ibig sabihin, it is ever-changing. So, again, since health is ever-changing, magbabago din yung mga determinants of health mo yan. Okay? However, focus lang tayo kung ano yung binanggit ng ating reference book, which is si Mackenzie. No? Ito po yung 5 domains ng determinants of health according to Mackenzie. Okay? So, number 1 is gestational endowments. So, pag sinabing gestational endowments, that is your maternal and infant health. So, ibig sabihin yan yung mga buntis tsaka yung kanilang mga anak, no? Pag nanganak na sila. So, gestational endowments. Next is social circumstances. So, these are your social interactions, yung integral part of the community and public health, yung population, no? Yan po yun. Next, environmental conditions. So, ano po yung nangyayari dun sa kapaligiran, no? That's why in our previous picture, meron tayong flooding dun, no? So, that is also a factor, no, to determine health. Next, yung behavioral choices, kung ano yung knowledge niya toward sa isang particular health issue, yung kanilang attitudes, their perceptions, no? Ano yung pananaw nila or paniniwala nila sa isang health issue. Okay? So, doon mo makikita or magigauge yung kanilang behavior, no, toward a particular health issue. And lastly, we have the availability of quality medical care. Okay? So, next. Yan. So, from this point onwards, magkakaroon tayo ng differentiation ng health. So, first things first is community health. So, before we proceed with the community health, let's discuss community. So, ano ba yung community? So, these are a group of people who have common characteristics. Okay? So, for example, ayan. Next is, they can be defined by location, race, ethnicity, age, occupation, interest, in particular problems or outcomes or common bonds. So, say for example, ang Holy Angel University, we have your faculty, we have non-teaching personnels, we have the students, no? So lahat po yun, they are all members of the Holy Angel University community. Now, ano ba yung pinaka-common na problem natin? So, say for example, ako, ang nakikita ko lang is laging walang bidet sa mga banyo, no? So, if that is our common problem, ang iisang community would then be interested on a single problem, no? And we can be defined as a single community because of that particular specific problem sa community lang natin. Okay? So, ganun po yun. Another example, so kayo, mga medtech students kayo. So, there are different medtech students in the whole Philippines. Pero, you're all member of what we call the FISMETS. Diba? So, ngayon, you can be defined as Medical Technology Students Community. No? Isang community niyan kayo. Okay? So, ganun po yun. Another example will be the LGBTQIA+, no? So, sila, iba't iba, hindi naman sila sa isang lokasyon lang, right? So, all throughout the whole world, iba-iba yung lokasyon nila. However, meron silang iisang particular problem, no? Which is, marami naman, no? Kunwari, yung kanilang discrimination, no? So that is one of the problem, merong discrimination towards them. So basically, that is their common problem, particular problem. However, as you may notice, iba-iba yung lokasyon ng mga LGBTQIA. So however, they are part of a community. So that is community, a group of people who have common characteristics. So pag sinabing community health, so, health status of a defined group of people and the actions and conditions, both public and private. Okay? To protect, and to preserve their health. Okay? So, ganun po yan. So, next is public health. So, public health naman, there are different definitions. No? So, dito po, huwag kayong papalito kasi different references, different definitions. So, pero bibigyan ko lang kayo ng dalawang simpleng definition dito. So, public health is a science and art of preventing disease, prolonging life, promoting health, and efficiency. Actions that society takes collectively to ensure conditions in which people can be healthy. And it is also a branch of medicine that deals with the diagnosis of health status of the community to give solution to the problem seen in the community. So in short, pag sinabing public health, it is also associated with the community health. However, sabi nga kanina, community health, it is both private and public. Pag sinabing public health, public lang. Ibig sabihin, those which are held by the government. Yung responsible for their health is primarily the government. No? Paki-take note yan. There is a government responsibility towards the health of that particular community or for that particular population. Yung government yung responsible. Okay? Next, we have ito maliit lang, no? Maliit lang kasi hindi yan yung focus natin for this particular course, no? Which is the CPH, no? Medical or na clinical health. So, pag sinabing medical or clinical health, ang only focus dito is individual. No? Isang tao lang. Okay? Individual health. And the data is physiologic. Ibig sabihin, kung ano yung signs and symptoms ng pasyente mo. Unlike dito sa community and public health, ang data natin dito would be numbers, statistics. That is why ang public health or yung CPH, it is tied with epidemiology as well, which will be further discussed along the way eventually. Next, we have the population and global health. Pag population health, health outcomes of a group of individuals, including the distribution of such outcomes within the group. Nagkaroon na ng distribution, frequency distribution dito. No? Nandito na yung mga measures of disease occurrence, measures of incidence, no? Yung mga yan, mga epidemiological terms po yung mga yan. Okay? And pag global health, syempre, global. Pangkalahatan na, pangkabuong buong mundo. No? Health problems, issues, and concerns that transcend national boundaries. Okay? So, this is the summary natin, no? Yan, community health, public health, population health, global health, and yung naputol is medical health. Ang definition lang doon is individual. Okay? Pwede mong pause kung gusto mong i-take note. And okay na. Next. So, next topic is the history of public health. First is the ancient civilizations. So, this is before the 500 BCE. So, prior to 2000 BCE, back then, they have found that there are archaeological findings that provide the evidences towards meron silang practices of sewage disposal and meron din mga written medical prescriptions. So, meron silang sewage and toilet systems were already available. Circa 1500 BCE, sabi sa Book of Leviticus sa Bible, there are guidelines, no? Nagsulat sila ng guidelines for personal cleanliness and sanitation. And meron din silang mga written works about quarantine, no? Or yung isolation ng mga certain diseased individuals. For circa 1900 BCE, andyan yung Code of Hammurabi. So this is considered as the earliest written record of public health, which include laws for physicians and health practice. So ito po yan, no? So as you can see, merong mga sewage, mga kanal, no? And mga toilet areas back then, before 2000 BCE. So, ito naman yung sa Book of Leviticus, sabi niya may law of the leper kasi daw pag nagkaroon ng leper or yung leprosy or yung ketong, no? Pag nagkaroon ng ketong, yung isang pasyente, kailangan mo siyang i-isolate or i-quarantine, no? Ihiwalay sa mga healthy people para hindi siya makahawa. Which is totoo naman, which is tama sila. Okay? And this is your Book of Hammurabi and your earliest written records ng mga physicians tsaka mga medical transcriptions, no, mga prescriptions tungkol sa mga pasyente back then tsaka mga physicians. Okay? Andyan din kung magkano yung binabayad sa physician, no, kung magkano yung binabayad sa kanya, depende sa kung paano niya na-treat yung pasyente niya, no. It is interesting, so you could research about it. Maganda yan, Code of Hammurabi. Next, we have the classical cultures. This is 500 BCE. So, meron tayong Greeks. Okay, 500 BCE hanggang earliest Christians, no? So, Greeks involved in the practice of community sanitation. No? Sila yung nagpasimula niyan. Community, ibig sabihin, there is already a community na ang target nila is yung target problem nila is their hygiene. So, nagkaroon na ng sanitation. So, they are involved in obtaining water from sources far away, not just local wells. Okay? Ang Romans, they improved community sanitation. Ito, please take note, they built aqueducts. So, ano yung aqueducts na yan? These are infrastructures na nagtatransport ng water from and to the city, no? Dun sa Roman cities. So, they built sewer systems to bring clean water. Okay? And also to remove those dirty waters. They are also the ones who first built the first hospitals. The Christians naman, so syempre dito na yung mga CE, no? They created hospitals as benevolent, charitable organisms. Pag sinabing benevolent, these are non-profit, hindi kumikita, no? So kumbaga pang charity lang or volunteer work. So yan, so these are your Romans also. Roman aqueducts, no? So which system. So as you can see, yung mga Greeks, sila yung nagsimula ng community sanitation. Syempre sila rin yung nagkumpisa ng medicine through Hippocrates, no? Pero syempre, they also start the community sanitation. Aqueducts, sewer system from the Romans, tapos benevolent sa mga early Christians. So medieval age or the Dark Ages, that would be 500 CE to 1000 CE. So nagkaroon ng growing revulsion for the Roman materialism. So pag sinabing Roman materialism, nagkakaroon ng focus on objects, mga possessions, kumbaga yung relationship ng mga people from their physical world. So this can also be comparable sa nangyayari today. Yung nagkakaroon ng relationship yung mga tao sa kanilang mga gadgets, sa kanilang mga smartphones, no? Or sa AI. So that is also called as materialism, no? Next, sa medieval age din, nagsimula yung spiritual era of public health. So, ibig sabihin nito, ayan yung kasunod, they blame diseases from God's judgment. So, nagkakaroon or hindi sila nagkakaroon ng logic dun sa mga disease causation, no? Ibig sabihin, yung mga health problems daw, they believe na they are deemed to be caused by spiritual concerns or nanggaling siya sa spiritual origins. And ang magiging solution mo lang dyan is, once again, spiritual. So, nagiging illogical and hindi siya scientific based or hindi siya empirical. So, marami talagang mamamatay because of this. So, ano po yung mga sakit back then? We have the Black Death or yung Black Plague or yung bubonic plague. Yan. Bubonic plague caused by your bacteria Yersinia pestis, no? Yung galing yan sa mga rat fleas, yung kuto ng daga. Okay? So, bakit Black Death? Kasi nga, bago sila mamatay, yung mga singit-singit nila or kung nasaan yung mga lymphatics nila, no? Mangingitim. Nagkakaroon ng boils na itim. Okay? And then, puputok yung mga yun, lalabas mga nana na meron ding laman na Yersinia pestis or microorganism causing the black plague. Also, the leprosy. So, syempre, back then, no, meron ng leprosy. Di ba nga, noong Book of Leviticus pa, meron na. So, hanggang ngayon, meron pa rin leprosy. So, yun yung ketong caused by your Mycobacterium leprae. Tapos, meron ding mga smallpox, diphtheria, measles, influenza, tuberculosis, anthrax, trachoma. Kumalat din yung syphilis during 1492. No? Yan. By the way, as you may have noticed, itong mga sakit na to, collectively, they are all communicable diseases. Okay, communicable diseases. Ibig sabihin, mga sakit na nakakahawa. No? So, ayan, leprosy, yan, Black Death yan. This is syphilis. So, as you can see, syphilis, this is a sexually transmitted infection caused by a bacteria, no? Treponema pallidum. Tapos, ang nangyayari is, ang ginagawa niya, pupunta siya. So, after niyang infect yung reproductive tract, hahanap siya ng mga soft tissues, mga cartilage, tas dun niya sisirain. No? So, that's why, kung mapapansin nyo, if you're going to look at pictures of prostitutes or mga patients infected with syphilis during the olden times, makikita nyo, wala silang ilong, sira yung kanilang tenga, no? Tanggal yung tenga nila, no? Because yun yung target ng syphilis, no? And one of the targets ng syphilis, tatanggalin yung mga soft cartilages. Okay, so yan, no? Sabi ko nga, no, most of these diseases, they are all communicable. Kung mapapansin nyo, bakit kaya di sila nagagamot? Kasi nga, back then, wala pang antibiotics. Hindi pa na-discover yung antibiotics. Paano ba nila dinagamot? Spiritual. So, pinagpe-pray sila. So, walang nagagamot. Okay, next. Renaissance and exploration. Sorry. Typo. Yan. Renaissance and exploration, this is 1500 to 1700 CE. So, pag sinabing Renaissance, this is the rebirth of thinking. So, nagkaroon na ng logic yung mga disease. No? Nagkaroon na ng reason behind them. So, this was caused by environmental and not spiritual factors. So, pinauso din nila yung tinatawag na malaria. From the word mal, which is bad, and aria, air. So, malaria. So, ang malaria, alam natin yan hanggang ngayon, meron pa rin. It's caused by parasite, Plasmodium species, no? Carried by your mosquitoes. So, this is observation. They are more accurate descriptions of symptoms and outcomes of diseases. Nagkakaroon na ng mas accurate. Linilista na nila yung mga signs and symptoms ng mga specific diseases. So, they have recognized whooping cough, no, Bordetella, pertussis, typhus, no, scarlet fever, and malaria. 1662, yan, pakitake note, naka-underline, tsaka naka-bold na siya. Si John Grant. So, this is your father of demography. Nakalimutan ko sulat, no? Please take note. Si John Grant ang father of demography. So, siya yung nagpasimula ng demography or yung pag-take note ng vital statistics of the community or of the public. No? Sinulat niya yung tinatawag na bills of mortality. No? And nandito, makikita niyo yung simula ng vital statistics. Sinulat niya or linista niya kung ilan yung mga namamatay, no, dun sa isang community, yung mortality rate, no? So, yun yung simula ng demography. Okay? Next, epidemics. So, malala pa rin. Rampant pa rin yung smallpox epidemics, malaria, plague, no? And yung plague, yung bubonic plague or yung black plague, it killed 15% of the population in London in 1665. Kasi wala pa rin treatment eh. And then, in the Renaissance and exploration, dito rin nag-start yung exploration. So, dito na rin mag-i-start yung history sa Pilipinas, no, ng public health. Wherein there is a spread of disease to the colonists and the indigenous people throughout the New World. Kasi syempre, those people are carriers of disease, yung mga explorers. Now, pagpupuntahan nila, so iba yung temperatura sa kanila, iba yung mga dala-dala nilang mga hayop, no? Yung mga sakit ng hayop na dala nila. No? Iba-iba yung kinakain nila, iba yung practices nila. So, pagdating nila sa isang bagong location or sa bagong bansa or sa bagong lugar kung saan may mga indigenous people, no, na that they are not immune or they are not suited sa mga sakit na dala-dala ng mga mga explorers, mahawa sila to the point na maaari silang mamatay at maupos. So, yan. So, this is John Grant, the father of demography. Sinulat niya yung Bills of Mortality. Yan. So, ito po is what we call a plague doctor. Yan, medyo nakakatakot itsura niya. So, yung beak niya, lalagyan nila yan ng maraming herbs, no? Ng mga mababangong herbs, no? Kasi nga, ano bang sabi nila? Bad air daw yung reason because of diseases. So, they thought na yung mga herbs na yan, mababango, they could prevent yung disease, okay, from the air. So, ayan, plague, 1665, 15% ng population ng London namatay. Ayan, explorations, so mapansin nyo, yung mga indigenous people, maaari silang mamatay because they're carrier ng diseases yung mga explorers. Okay? Next, 18th century, that is your 1700 CE onwards. So, this is characterized by the industrial growth. So, ibig sabihin, the living conditions were hardly conducive to good health. So, nagkakaroon ng overcrowded populations sa mga syudad that could lead to unsanitary water tsaka unhygienic practices. Dito rin mapapansin yung start ng unsafe working conditions, no? So wala pa yung occupational health, no, sa mga tao. And please take note, pangalawang tao na kailangan yung tandaan, si Edward Jenner in 1796. He introduced the smallpox vaccine. Sir, bakit introduce? Bakit hindi discover? Bakit hindi develop? Bakit hindi invented? So, introduce because the vaccination process started as what we call variolation. Yan. Yung variolation practice, nag-originate yan sa China as well as sa India. So, ang ginagawa nila, yung mga smallpox patients, nagkakaroon sila ng parang mga sugat-sugat. Pag natuyo na yung sugat na yon, babakbakin nila, no, susunugin, and then ipapakain or ipapa-inhale sa mga ibang pasyente na healthy. Okay? Imagine nyo? So again, yun yung tinatawag na variolation. And it is effective because nai-intake ng mga healthy patients yung mga inactivated na viruses. When in fact, ang nangyayari nun, pag na-intake nila yun, nagkakaroon sila ng immune defenses towards them. Nagde-develop sila ng immunization. And technically, yun din yung ginawa ni Edward Jenner. Dinevelop niya lang, no? And then inintroduce niya. And instead of variolation, ang tinawag niya dyan is vaccination. Bakit vaccination? From the word vaca, which means mga baka, cow. Bakit cow? Because napansin niya back then si Edward Jenner, yung mga milkmaids, no, yung mga dumidede sa cows, no, yung kumukuha ng gatas ng cows, nagkakaroon sila, hindi sila tinatablan ng smallpox, no, kasi sila ay carrier ng cowpox virus. So meaning nagkakaroon sila ng immunity towards smallpox. Nagkakaroon ng cross immunity. So, ang ginawa ni Edward Jenner, yung mga milkmaids na yan, kumuha siya ng kanilang mga samples and then in-inject niya doon sa mga healthy children. No? And then those healthy children, nagkaroon sila ng immune defense towards the smallpox. No? So, that started yung vaccination. Okay, so ayan po, no? Si Edward Jenner, in-inject niya yung mga bata, mga baby. So, saan galing yan? Ayan, sa mga milkmaids. Yan. Also, yung overcrowded, tsaka working conditions, 1800s. Okay, please take note, no? Dalawa na yung binanggit natin. We have si John Grant, father of demography. We have here Edward Jenner, introduced smallpox vaccine. 19th century, this is 1800s onwards, no? So, there is a predominance in the miasmas theory. So, pag sinabing miasmas, yung vapors daw or yung miasmas are source of many diseases. So, kumbaga, pinagpatuloy niya lang yung malaria, no? Yung bad air. Okay? Si Edwin Chadwick, who produced a report in 1840 about unsanitary living conditions of poor, and ano ginawa niya? He linked it to the diseases. Kung paano naging unsanitary yung mga poor daw, yung financial factor na yun, linink niya sa disease. Okay? This influenced public health legislations. Dito na nag-start yung public health policy or public health legislations. So, the modern era of public health is considered to began during the 1850s, and hanggang ngayon, ito pa rin yung tinatawag nating modern era of public health. 1854, ito na yung pinakasimula ng public health. Sino po yung pinaka nagsimula niyan? That is your Dr. John Snow. Yan. Take note nyo yan, ha? Importante yung mga yan. So, si Dr. John Snow is considered as the father of your modern epidemiology. He is also the father of public health. Okay? So, it is believed that the sewage dumped into the rivers and cesspools near town wells could contaminate water supplies and cause cholera outbreaks. No? So, back then kasi, dun sa syudad ni John Snow, nagkaroon ng cholera epidemic. No? So, caused by bacteria, Vibrio cholerae. Siyempre, di pa nila alam yon. So, yung cholera na yun, nagtatrive yan sa mga tubig-tubig. And napansin niya, tinchinek niya yung epidemiological data. No? And napansin niya na most ng mga nagkakasakit are those patients that are living around the wells, no? So kunwari yan yung mapa, andito yung mga well, yung mga source ng tubig nila, no? Napansin niya na yung mga nagkakasakit around those areas lang. Okay? So ang ginawa niya, sinara niya yung mga wells na yun and lininis niya, no? Or nagkaroon siya ng mga policies na ayusin yung sanitation ng mga tubig na yun. And because of that, maraming gumaling, no? Or nabawasan yung mga cholera. Okay? So that is your Dr. John Snow. 1875 to 1900s, bacteriological period of public health. So, dito na po nag-start yung germ theory by Louis Pasteur. No? Other than that, marami pang dinevelop si Louis Pasteur, mga vaccinations towards rabies, no? Pasteurization ng milk, and etc. And pinagpatuloy yan ni Mr. Robert Koch. Ginawa niya yung co-postulates. Yung co-postulates, yan yung dinevelop niya lang yung germ theory. So basically, pag sinabing germ theory, this is the spontaneous generation of germs. Ibig sabihin, iwan mo yung isang germ or isang microorganism sa isang petri dish, no? After a few hours, dadami yan. Spontaneous generation. Pero if that germ hindi mo siya bibigyan ng additional nutrients or hindi mo siya bibigyan ng conditions na for its optimum growth, titigil yung growth niya. Okay? So, ganun po yun. Hindi pa siya ganun ka-polished. No? However, nagkakaroon na ng magandang start towards sanitation and bacteriological studies. So, dinevelop yan ni Mr. Robert Koch. So, nagkaroon ng postulates, Koch's postulates, wherein it states that there are specific germ cause specific diseases. No? Take note, no, ang term pa nila dito, or ang term pa na ginagamit nila is the layman terms germ. No? When in fact, ang medical or correct medical or clinical term dyan is microorganisms. Okay? So, again, pag germ theory, spontaneous generation of germs. Kapag Koch postulates, that is your specific germ cause specific diseases. So, ayan. Ito po si Edwin Chadwick. Siya yung nag-start ng public health legislations, no? Because napansin niya sa mga poor areas, relate niya yung disease. Okay? And this is si John Snow, father of modern epidemiology and father of public health. So, sinara niya yung mga, or tinanggal niya yung pump handle ng mga wells, no? Preventing cholera. Next, you have si Louis Pasteur. So, pasteurization, no? Yung germ theory of the disease. And lastly, we have si Robert Koch. So, yung ginawa niya is yung Koch's postulates. Next, 20th century, this is your 1900 onwards. So, from 1945 to 1948, it's the foundation of WHO through the UN diplomats. April 7, 1948, Constitution of WHO came into force, basis of World Health Day. The 1959 WHO Global Smallpox Eradication Program, and 1980, smallpox is declared to be eradicated. So, ayan. No? Nag-start na yung WHO, and 1980, nawala na yung smallpox. Now, 21st century, that is your year 2000 hanggang sa ngayon. So, there's an increased role of technology and broader understanding of health, and focus on global and community-based solutions. So, you have your Millennium Development Goals. Pag-aaralan natin yan. There are specific goals of health. Non-communicable diseases na ang naging focus ngayon, which are, for example, yung heart diseases, stroke, diabetes, yung mga lifestyle diseases, no? Yung hindi nakakahawa, kumbaga. 2009, nag-start din yan yung mga pandemic H1N1, epidemics in Ebola 2014, nagkaroon ng SDGs or yung Sustainable Development Goals, which are 17 goals, no? And lastly, recently we have the 2019 2019 nCoV, novel coronavirus, which eventually naging COVID-19. So ayan, so this is your SDGs. Non-communicable diseases, and these are the different viruses. This is Ebola, H1N1, COVID. This is your SDGs. MDG pala to, Millennium Development Goal. This is your SDGs. And I think that's it, no? So hopefully you have listened to this discussion. Ay, sorry, nahulog. If you have any other questions, don't hesitate to email, no? For now, hindi ko muna bibigay yung activity, pero might as well read na kayo about the history of public health in the Philippines. Nakasulat ko dito. Basahin nyo na lang History of Public Health in the Philippines. Yan. Okay, so mabilisan lang kasi nating itatakal yan by next week. No? So, might as well na magbasa na kayo ng patungkol dyan. Marami namang source sa internet with regards to that. Okay? So, other than that, hope you have learned something, and this will be our start of your public health lecture, CPH. Again, if you have any questions, don't hesitate to email me. And that's it. Okay, good day.